Hello, good evening, good afternoon, good morning, everyone joining us on this live broadcast. Sorry, we had a bit of technical itch when we started. So we're back and we're live. It's ATP Live. Today we have our family physician with us, Dr. Rotimi. So Dr. Rotimi will be here to answer every of your questions. Dr. Rotimi, good evening, sir.
Good evening, Vera James. Thanks for the invitation to ATP Live.
Sir. You're welcome, sir. So I'll just quickly share this on our groups and on Facebook. So if you're joining us live, please let's spend the next 1 minute sharing this video while we invite our friends and everyone to join us. Okay, so Dr. Rotimi, how was your day?
Very fine. And yours?
It's been amazing. We thank God. Okay, so we're sharing and we're hosting watch parties. So if you are watching, please share, please host a watch party and let people know that ATP Live is on. Okay, let me just quickly do that before we start. So thank you, Princess Lorita Ude. Good evening. You're welcome. Thank you for joining us. Today is there's something interesting about today. So you are free to ask questions about yourself. Dr. Rotimi is a family physician. So today is about you. Remember, it was Mother's Day on Mother's Day last
Yeah,
week,
yesterday.
Women's International
Yesterday.
Women's Day last week, then Mother's Day yesterday. So the month of March is for mothers. So we want to celebrate you, every mother, every parent on ATP. We want to celebrate you. And today is your day. So enjoy yourself today. Ask Dr. Rotimi any question as it relates to your health. This is ATP, but we are having today's edition with the family physician. So Dr. Rotimi is here to answer the questions for you, for grandpa, grandma, aunties, uncles, and everyone. Thank you, Christiana Ellie Douglas. Good evening, ATP
Thank
crew. I
you.
celebrate you guys. Thank you. Thank you. Good evening, Doctor. Good evening. Yes, good evening, Uche. Good to have you. So please ask your questions while I'll just be hosting a watch party on the group. So while we're doing that, begin to ask your questions because we have just 1 hour to have our family physician with us. Thank you, Ijoma, for coming on the show. Thank you for joining us, rather. Thank you, Ijoma. Thank you, Osinachi Uche. Do you have any questions for Dr. Rotimi today? Please go ahead and ask your questions. Please go ahead and ask your questions. So, Dr. Rotimi, before I'm sure that people are getting ready while I'm trying to sort out the watch
Okay.
party. Let me ask you a question. So, tell
Okay.
us, what's this thing about fibroid and having a baby in the womb? Is what's the Someone was asking recently that she has a fibroid in her womb and she has a baby in that womb. I mean, what's the survival rate? What's the chance for that child to survive? What should the mother do?
Okay. Thank you for the question. Well, in some cases, fibroid normally coexists with the fetus. That's the baby that is yet unborn. When such happen, the person may need extra care. We call such mothers, we normally say they are at high risk, or we call it
Okay.
high risk pregnancy, in the sense that such pregnancy need to be monitored as often as possible, much more than if it's a pregnancy without a fibroid. And in such case, because of some of the things that come with it, like heaviness from the mother, swollen legs, bleeding, which we call threatening abortions, which bring a lot of them to the hospital every now and then. Because of all those ones, we term it as part of the high risk pregnancies, and such people are normally seen very often. Like, normally during the antenatal, I'm sure Dr. Jumoke have mentioned it in the past. At the beginning of the antenatal, we see women every 2 weeks. and towards the last trimester, we see them every week. But in case of fibroid, we start seeing them like almost every week because you don't want the person to have what we call preterm contractions or threatening abortion, or you don't even want the person to lose the pregnancy.
All right. Thank you so much, Dr.
Mm.
Rotimi, for that. Okay, so we now have questions. So let's go on to Vivian Ifine is asking, what is the best and safest family planning method? The best and safest.
Okay, this is a big question. The best and the safest family planning method. Where is we can say this can be individualized based on the medical history of the person that is concerned. Because let's say some women that are prone to having overweight, that are prone to having obesity, or those that are prone to having high blood pressure, like those ones, we can say the best for them will be the non-hormonal. Non-hormonal are the IUCD, the use of barrier method like the condoms, the diaphragms, or even the permanent contraception, which is BTL, bilateral tubal ligation. Because the hormonal one, they are likely to make the person to add more weight. They are also likely to make the person to develop high blood pressure. So if somebody is already having the risk, we try to go away from there. So for those that have medical conditions like blood pressure, clots issues, we run away from the hormonal contraceptive. That is the injection, the implants. So that one will not be the best for them. The non-hormonal will be the best for them. But for other women, like women that are slim, that have moderate weight, that have not fallen under overweight, the best long term for them will be the injectable and the implants, depending on what they want. So that's how we rate the best and the safest. In terms of the safest, the hormonal normally have one side effect or the other because they're actually drugs. We know that every drugs, even paracetamol, has side effects. So they have side effects, but the doctor normally look at the benefits compared to the harmful part of it before recommending such hormonal to the client that is involved. We don't use patients in family planning clinic. We call our we call them clients. We don't
Okay.
call them
Okay.
patients. Yes.
Okay, they are not
In
sick.
fact, yes, in family planning clinic, they are our clients, not patients.
Right, right. Okay, thank you so much for this insightful one. So we know that Dr. Rotimi has told us that it has different various factors, and I'm sure that you're happy, Vivian, with the response you just got. Okay, so if you're watching live, it's okay. You drop your questions on the live video, and we'll take it immediately. But if you're watching on the watch party, we'll have to have our moderators move the question from the watch party to the live. So I think it's best to just go on the live so that you're asking your question directly. We're seeing it and taking it immediately. So we'll go on with Ismail Ali's question. Ismail Ali is asking, a pregnant woman feeling like mild like menstruation cramp, what should be done? Okay, so he wants to know what should be done when a pregnant woman has some sort of cramp.
Okay, Ismail Ali, thanks for the question. When a woman has cramp, the especially if the person is a first-time mother, which we use the term FTM for, if such cramp is happening, it's advisable the person go to the hospital because the cramp is a sign that there is uterine excitation, that the womb is contracting. And anytime the womb is contracting, there may be danger knocking at the corner. So what we do in the hospital is that once we check all the vital signs and check that the person does not have things like infections, malaria, that normally leads to these preterm contractions, we just place the person on a drug that we call salbutamol. That drug will stop that contraction that the person is having, but the person must present in the hospital first. In some cases, when it is available, the doctor may also make use of the scan to be sure that all is well with the baby. Thank you.
Fantastic, fantastic. Thank you, sir. Okay, so Thank you. Good evening, Blessing Joseph. She's saying good evening to us. Okay, Vivian that asked about family planning. She just says, "Wow, I've learned something new." Thank you, doctors. You're welcome,
Thank
Vivian.
you.
So keep asking your questions, and we're here. Okay, so Bolariwa is asking, "What's the best method to stop a child from tiptoeing? Maybe a child that tiptoes, a 1-year-old boy, a baby rather."
Okay. Where the our children during the early milestone, there are different ways that they achieve this milestone. I'm sure you have heard of some children not even crawling before they start standing up. But what I will say is that after some months, that tiptoeing will subside. The child will be able to put the leg on the ground by itself. You don't need to do anything. You don't need to force the child so that you don't get to break the bone of the child, because the child is just learning the steps of walking. He's just learning to stand gradually. Within 1 or 2 months, the child that is tiptoeing will be able to use the sole, the back of the sole, will be able to rest on it. It's a trying moment for the children. They are afraid that they may fall down, since they are just trying to stand up and make efforts to walk. So it's not a medical condition for a child to tiptoe. Just observe the child well, follow the trend the child is going. It's not harmful, and don't let anybody deceive you that it's a wrong sign or the other, because we have some other people out there that will give all these myths to us, which are not really acceptable medically. So a child that is tiptoeing very
Yeah.
soon will be able to stand on the sole, will be able to stand on the legs by himself. You don't need to do anything. You don't need to force the child. Just follow the trend as it happens. Thank you.
Thank you so much, Doctor. Thank you for that. Okay, Dr. Bimi is saying hello to us. Good evening, Dr. Bimi. Thank you for giving us the opportunity
Good
to come
evening,
on the
bro.
show. Okay,
Thank you,
so
Dr. Baby.
Abimbola asking, how best can someone handle the case of sleep disc in an adult of 49?
Okay, yes. Cases of sleep disc normally present with back pain. The person that is concerned is unable to bend, maybe having severe pain on both legs, or maybe having what you call paresthesia, as if blood is not flowing on the leg. And sleep disc simply means that there is a shift in the bone of the back. Those bones at the back are called vertebrate bone. Once there is a shift, that's what we call sleep disc. And medically, it leads to a condition we call lumbar spondylosis. And when that happens, one of the first things that the person needs to do is to get to the hospital. In some cases, a specialist may be involved, an orthopedic surgeon. Also, part of the management is physiotherapy. That's the exercise part of how to move the back and the rest. And physiotherapy also include other form of treatment like light. By shining light on that particular part, it helps to relieve the pain there. Then they may also give lumbar support. Lumbar support is like a belt that one will wear under the cloth. It helps to put the vertebrae in shape. And in the hospital, we give such patients, we give them a painkiller, we give them a drugs for the nerves, because the nerves that supply the legs are from that place that the sleep disc normally happen. So we give them drug to also prevent paresthesia. And much more than that, they can also use topical ointments like methylsalicylate, like rub. They can also use that. Then, so in some cases, we recommend the posture they need to take at home, the type of chair, how they are supposed to sit. In some cases also, we may recommend orthopedic bed, so that when the person is lying down, the bed will be firm. So these are the ways we manage sleep disc. It's common. The advice for people that have such is to also avoid carrying things that are very heavy. Don't carry a 50 kg keg. Don't carry a 25 kg keg. If you have to do that, you may need somebody to support you. When you are going to the bedroom, since it's believed in our environment, most of the water may not be running. By default, when we have to carry buckets, somebody may help or assist to carry that bucket to the bedroom, so that you not put pressure on that back. So that's how we manage sleep disk.
Right. Thank you so much, Dr. Rotimi. So Adiola is asking, good evening, doctors. My son of 5 years old usually grind his teeth when sleeping, and I'm tired of it. Is there no remedy to this at all, to all of this? Grinding
Okay,
his teeth.
yes. At times, grinding the teeth, which you call bruxism in medical parlance, uh, may be like it may just be an habit, but you don't just stop there. The next time you are seeing a pediatrician, let the child be assessed, because some children you may think that they are grinding the teeth, not knowing that they are convulsing. So the next time you are seeing your pediatrician, whether for the immunization or for any visit, mention it to the pediatrician so that they'll be able to look the child holistically
Oh, wow.
to be sure there is no other problem. But in some children, it's just an habit.
Okay, that's fine. So you heard that. It's you need to check with your pediatrician. All right. So Chidebere is saying, what's wrong with a child that is frequently running temperature 39.9 and no appetite?
Wow, 39.9 is almost 40 degrees. A child that is having this type of temperature, is an emergency. It's a medical emergency, because you don't want the child to convulse. The next thing, as the temperature is entering 40 degrees, the child may be convulsing next. And when the child convulses, it normally leaves some uh, sequelae. Some things normally follow the convulsion, which are not too palatable to the child. It affects the child in several ways. In trying to stop the convulsion, you may end up even injuring the child. You may end up even doing the wrong thing for the child that people normally do at home. But if such should happen, it's a medical emergency. The first thing, try and tape-sponge that child, get a lukewarm water, put towels inside the water and use it to mop the child body. It helps the temperature to cool down. Get paracetamol depending on the age. We have been taught on the Ask the Pediatrician group the how to use paracetamol as first aid, the
Yeah.
various dosages. You can just check our group and get the dosages. So you should give paracetamol at that point in time. And immediately you are able to take a sponge and give paracetamol. The next thing is to take the child to the hospital. 39.9 is what you call hyperparesia. Hyper meaning that this one is even more than hot. Hyperparesia is more than hot. So such child needs to be to the hospital.
Really
And
high.
in the hospital, the doctor have to do several tests, like full blood count. The full blood count will check whether there is any infection. The doctor will do malaria test, which is the commonest cause of fever in our environment. The doctor will check the urine for any type of infection. Also, when the doctor is also examining, we check the hair, the throat, and also the chest. These are other areas that can contribute to the child having fever. So this has to be looked at. A temperature of 39.9 that is happening with loss of appetite too is not too good. Such child should be taken to hospital after doing the palliative at home by the tape sponging and also the use of paracetamol. Thank you.
Olanikpekun Afonja Damilola, she says, my baby was tested after she presented with vomiting 2 days, and her food dog count had normal readings, malaria 1 plus, and the malaria was treated. Her stomach is bloated and constipation. Okay, treated, but she still pulls like 3 times daily. Okay, which will still which will start with hard normal stool and then watery stool later in the evening. Her appetite is still poor. She's 1 year, 3 months, and she weighs 9 kg. So
Okay,
I can see that she has a second question. So let's see. What else can I
okay,
do? Although she's active and playing, but I'm worried for the poo and loss of appetite.
okay.
I'll just
A
leave the
child
question
that
on the screen.
Okay, a child that is 1 year is expected to be 10 kg. 1 year and 3 months, the least expected weight for a 1 year child is supposed to be 10 kg. This also depends on the birth weight, because a child is expected to be 3 times of the weight at 1 year, or 3 times the birth weight at 1 year. So if your child is up to 3 kg at birth, that means the child is not growing well. Then the loss of appetite, the stooling that have persisted, and the the fact that you said the child is not too active, if I guess right, require you to go back to the hospital. This is what you call follow-up. The mistakes that most mothers make is that after you have seen the doctor, they have diagnosed the child, they have given you drugs. If what you are seeing, because you are the doctor at home, if what you are seeing is not, if the child is not stable, we need to get back to the doctor. That's what we call follow-up. In some cases, doctor will need to do additional tests to look at other areas that he or she has not looked at previously. So this is just to encourage all other mothers here. The place of follow-up should not be left out. The fact that a child is admitted in the hospital or the child has been to the hospital today does not say that the child should not go back to the hospital. So this child in question needs to be taken back to the hospital for follow-up. The doctor have to examine again to see whether there is another existing condition that has not been done. So that's how your child needs to be taken for follow-up.
Okay, so Olanipekun, you heard that. Please take the child back to the hospital for a review. Vivian Ifeanyi is asking, what's the normal BMI for an adult that is still giving birth?
Okay, the normal BMI is body mass index. Mathematically is the ratio of the weight to the square of the height. So the normal BMI is 18 to 24.5. Then if a woman that is giving birth, like you said, that's a woman in childbearing age. If they are more than 25, it is said to be overweight. 25 to 30 is said to be overweight. You can easily get this one done by checking your weight, by checking your height. Then some phone also have the BMI calculators. That's the body mass index calculator. You just input your weight and height. It will give you the result. If you find that you are over 25, which is overweight, we encourage you to start doing exercise. The WHO recommend 3 to 5 times in a week, about 30 minutes in a day for a session, but 3 to 5 times in a week. To also watch what you eat, do more fruit, do vegetable, eat balanced diet. But in addition, do more fruit and vegetable. Take water instead of soft drinks. Take water instead of alcoholic drinks for those that imbibe in such.
Okay, thank you, sir.
Yes.
I'm sure you got that. Okay, Augustina is saying my baby of 4 months has something like cough on his throat. Whenever I bathe him, whenever I bathe him. So when I took him to the pediatrician for checkup, after the checkup with the pediatrician, the chest is clear, but she gave me Piriton for 7 days. He's still on the drugs, but that cough is still there because before the cough will clear, he has to cough first before it can clear. Please, what should I do?
Okay,
Maybe temperature is okay and feeding is okay.
Yes. Augustina Bright. In some cases, some of the causes of cough are viral illnesses. Most time goes on their own. You don't even need to use any drug, and it may take time in some cases. Then the other thing, at times there may be one throat infection or the other. There is no how apart from the tonsil, the doctor may not be able to see the back of the nostrils. There are some other organs, there are some other structures there, like the adenoid. All these ones to also allow accumulation of sputum in children, which can make them to cough. So if the pediatrician has already checked the chest and it is normal, and he has given the child drug, he said the child is playing well, the other thing that is left, you need to also go back for follow-up, like we have said. So what we need to do at that point the doctor may also need to go extra length by doing an ENT examination or referring you to an ENT, or by even requesting for an X-ray that we call postnasal X-ray. That's the X-ray that shows the back of the nose. There is an organ in children. Children have this organ called adenoids, which accumulates sputum and the rest, and it's also can also cause cough in children. So that needs to be looked into.
Okay, thank you so much, Dr. Rotimi, for that.
Thank you.
Chidebere is asking, what is wrong with a toddler when she sleeps, foamy saliva comes out of her mouth?
Okay, a toddler that sleeps with saliva foaming from the mouth, well, if it's only when the child is sleeping that the saliva comes from the mouth, I may say there is no need to worry. But if it happens all the time, even during the day, there may be infection with the salivary gland. In some cases, some children may have inflammation of the glands, like what you call parotitis. That will make them to have excessive salivary secretion. They also have fever in addition to that. That one happens all the time during the day, at night, plus fever. But if it's only at night, there is no cause for alarm. The saliva is always in our mouth to lubricate the tongue and the rest. There is no cause for alarm.
Okay, thank you, Doctor. I think our internet today is not friendly, but we'll just keep managing. Um, Adiola says, ATPN, you're the best. Thanks, Doctor, for always coming to our rescue. You're welcome, Adiola. Thank you also for joining our show tonight. Adeleye Oluwafumi is saying, good evening, doctor. My son of a month old has been crying consistently for 2 days, though he has been eating but been stooling as well. For instance, he has put like 5 times today. I checked his temperature this afternoon. It was 36.7 degrees Celsius. He has not been sleeping during the day. He has been awake for over 6 hours today. He just sleeps for 10 to 20 minutes. As at birth, he weighed 35.4
Maybe
kg. I
three
guess
point,
that's his level. Maybe, yeah. So
maybe 3.54 or so.
yes.
Oh, okay. Like one of the things I mentioned earlier, the mother is the first doctor. As the first doctor at home, you need to look closely at your child from the head to the toes, check the skin, check the body. Is there any rashes on the body? Is there any boil? These are things that can make the child to be crying excessively. Check,
Right.
use your hand to touch the ear, the 2 ears of the child. At times, the ear may be inflamed, which is a sign of ear infection. Check the legs, check the
Right.
body and everywhere. Then also try to observe when the child is passing urine. Does the child also cry? That could also be where the thing is coming from, the sign of urinary tract infection. But above all, after you have done all those and you are unable to see anything, the next thing is to take the child to the hospital for the doctor to, who have been trained in this area to detect what is happening to the child. A child that is crying consistently, something is definitely wrong. But because the child cannot talk at this stage, that's the child's way of communication. He's telling you that something is wrong with me, mommy, do something. Thank you.
Thank you so much, Dr. Retimi. So Mercy is saying that my baby girl.
Hello, Dr. Vera. Hello, Dr. Vera, are you there? Hello, Dr. Vera, are you there?
Sorry. I guess my network just
Okay.
disappeared. Dr. Rotimi, can you hear me?
Yes, I can hear you clearly.
Okay. I had a bit of a network glitch. So,
Okay, I guess as much.
Mercy's question, she talked about how that her baby runs before he stools, and then, but she says the stools is not hard, it's normal. Like for 4 days, he hasn't pulled. There was a period I gave him pap because the breast milk wasn't flowing, but Dr. Bemi advised me to stop, which I did last 2 weeks. Is this normal?
Okay, some children don't pass stools every day. Some take some few days to pass through, but there are some telltale signs, some things that you need to watch. If the stool, is very hard and the child cries on passing the stool, and that may mean that what you are feeding the child with is not enough. As your own case is concerned, exclusive the breast milk may not be enough. We don't encourage pap and the other. We encourage exclusive breast milk. So if you are not feeding the baby well, the stool may be very hard. But in some cases, some children take days to pass through. But what you need to check is that when the child is passing the stool, it's not hard. Okay, your baby will be 5 months. Yes. Once the child is passing the stool, provided it's not hard, it may take 4 days, it may take 5 days. While some children can even pass stools up to six to 8 times in a day, depending on how their body system is processing the breast milk they are taking. So what you are doing, the breast milk that Dr. Gbemi has advised you to imbibe in, is actually the best for your child, in the sense that your child gets all the nutrients that is needed for growth, for brain development, that will also provide immunity for the child from the breast milk. So I encourage you, keep breastfeeding the child. 4 days not passing through does not mean anything like we have said. Keep breastfeeding the child. Just make sure that you are eating well, you are taking enough fluid, you are taking enough water so that your breast milk can flow well and it should be enough for your child. Thank you.
Okay. Thank you so much, Dr. Rotimi. Thank you. Our next question is from Vivian. She's saying, how would you know that your child does not have enough blood?
Okay. Yes, you may need to know the age of the child but at home, how you know a child does not have blood, normally the palms are meant to be red. The palm, when you press the palm, we are meant to see some redness, which shows that blood are flowing. But in some children, the palm may just be white. But this one is also subjective, because some people are light skin and it may mislead the person. But if it's in the hospital, we check the conjunctiva, that's under the eye, the red parts under the eye. We just check to be sure that whether it is light or red. If it is red, that means the blood is okay. If it is light, but at home, there are some other signs that one may use to know whether the child is having low blood, like the child may be weak. The child may not be playing well. The child may not be interested in things that is
Dr.
happening.
Rotimi, can you hear me?
Yes, I can hear you. Hello, I can hear you, Dr. Vera. Can you hear me? Hello? Hello?
Okay.
Hello, can you hear me?
Yes, I can hear you now.
Okay. What I was saying earlier is that the low blood that Vivian mentioned means anemia. And when a child has anemia, the child may be very weak. That's one of the signs that the child may not be interested in the things that is happening around. The child may not be able to suck well. And also, physically looking at the child, the whole body of the child may look pale, may look lighter than normal. So I said earlier that this one may be subjective, because some people are light skinned. So one may miss that in light skinned people, because their hands are likely to also be light. But in the hospital, what we do is just that we check the conjunctiva under their eyelid, to see whether the child is losing blood or not. Also, if a mother is worried whether the child is losing blood or not, you can take the child to the hospital. A test can be done to check the blood level in the hospital and reassure the mother.
Okay, thank you so much, Dr. Rotimi. Nena Jacinta is saying, I started giving formula from birth. We are 6 weeks now, and baby weighed 4 kg at birth and 4.5 at 6 weeks. The nurse
Okay.
advised I try only breast milk. My question is it late to start exclusive breast milk when the baby is 6 weeks old?
Okay, it's never late to start exclusive breast milk, but the only thing is that the terminology may not be exclusive again, but the ones that has been done earlier made it not exclusive, because exclusive breastfeeding is feeding a child with breast milk for the first 6 months of life without any other thing like water or other food. But if the child has taken the food for the first 2 months like that, though it's not exclusive, but at this point, as you have made up your mind, to start exclusive breastfeeding, it will really help the child, because in exclusive breastfeeding, there are so many things that help the child brain's development, that help the child to grow, that help the child to fight immunity, that is vitamin A, all those things helps the child. Rena Awoso, my daughter seemed to be irritated from teething, and she wouldn't eat aside breast milk and solid in bed. I'm frustrated already. Well, Rema, I will encourage you not to be frustrated. I will encourage you not to be frustrated. Teething is part of the developmental process. Every child has to pass through the teething process. But just look at the signs that your child is having. Is your child having fever? If your child is having fever, you give paracetamol to bring the temperature down. You give paracetamol to bring the temperature of the child down. Teething is part of the developmental process. Many other things will come, but as a mother, you need to also support the child fully, continue breastfeeding the child, you know, continue supporting the child. That's how to overcome this. Adeyemi Olatunji Omowumi, good evening, doctor. Please, can all Good evening, doctor. Please, can ulcer cause back pain plus rib pains for adults? Yes, at times ulcer may radiate to the back. Ulcer pain may go to the back. Ulcer pain may go to the back at times. So ulcer pain radiates to the back. It is true. Ulcer pain can go to the back, but you start having the pain where we call the epigastric area. It can also go to the back. Okay, the grunting is my problem. Are you Good evening, doc. Thanks for the session. Please, I want to ask if infection can cause baby poo to draw a little bit. My son is having much talking stomach. Please, what can I do? We are on EBF, 3.6 kg weight at 2 months, 5.5 kg at 3 months on Friday. Yes, your child is actually doing very well. Your child is actually doing very well. The fact that the baby poo is drawing doesn't mean harm. It's not harmful to the baby. Part of the thing that helps in the digestive process are the mucus. That's why the thing is drawing. So it's not harmful. Adebola Adegoke, my baby of 1 year weigh 9 kg. Concern about his birth weight was 2.72. Hope the weight is okay. Yes, I said earlier that a baby, though, is expected to be 10 kg at birth, is also expected not to be less than 3 times of the birth weight. I think your child started, with a low birth weight. with a weight that is low, although a bit higher than the low birth weight. Low birth weight children are children that are less than 2.5 kg. But your child started with a weight that is less than 3 kg, but now the child is more than 9 kg. That means the weight has tripled. The child is doing fine. Your child is doing fine. So we put it in reference to the birth weight. Your child is doing fine. Please, doc, my 7-month baby don't like taking family soup. Only cereal, pap, breast milk. Should I be worried? Thank you. Yes, you have to do this gradually. You have to do it gradually. You know, change is normally difficult. Your child is changing from the first 6 months, whereby he only take breast milk, to where he started taking cereal and pap, which we call weaning. So the weaning period, it may be challenging for some mothers, but you need consistency with that. Very soon, your child will start taking the family soup. Just continue with the cereal, the pap, and the breast milk that you are already giving. My son don't eat since the completion of EBF. It's a year now, and yet he refuses almost everything I gave him. I have to force him each time. How can I overcome this? My son don't eat since the completion of EBF. It's a year now, yet he refuses almost everything I gave him. I have to force him each time. How can I overcome this? Yes, well, you need consistency. Just this stage, I tell mother, is the experimental stage, you know, because the breast milk cannot give the child all the nutrients that the child needs at this point. So you need to introduce those other things. You need to introduce other things and try to make feeding friendly to the child. You know, the cup or the plate that you are using, make them to be attractive to the child. Try and put the spoon to the child for the child to make efforts on his or her own. Try and put different types of meal in front of the child. And on your own too, also try to feed the child. It may be in piecemeal, it may be in small quantity, but the child will definitely get there. At this stage, the breast milk is no longer enough to supply the child what the child needs. Thank you. My baby at birth was 4.5, at 3 months, 8.2. Hope the weight is not too much. Your child is doing very fine. In short, at 5 months, at 5 to 6 months, a child is expected to be ×2 of the birth weight. So your child is just 3 months and is already 8.2. That means at 5 months, your child is going to be more than 9 kg. So your baby is doing very well. I encourage you to continue exclusive breastfeeding, you know, which is what we preach on our platform. Your child is doing well. My baby weighs 4.5 kg at 3 months, 8.2 of the weight. I just answered this question. Your child is doing well. So at 5 months, 5 to 6 months, your child is expected to be ×2 of the birth weight, at least 9 kg, and your child is almost at that 9. He's doing very fine. Good evening, doctor. Please, my baby of 3 years plus has problem after stooling. If I want to clean his anus, I will notice blood stain in the wipes that I use. What is the problem? Wow, at 3 years. I think you need to take the child to the hospital. There are many things that may make the stool to be getting stained with blood. We have things like dysentery. You know, we have things like even hemorrhoid, even though it's not common at this age group. And we have other things that can make the child to be having this bleeding blood in the stool. This child needs to be taken to the hospital. It's what I call emergency. Take the child to the hospital, let the doctor see the child. The doctor will examine the child. They will do what we call rectal examination. The stool will also be tested for worms. You know, the stool will also be tested for worms to be sure that whether it's also is worm that is causing the stooling, and for some bacteria that cause what we call dysentery. Dysentery is simply when you see blood in the stool of the child, and there are many causes, so many bacteria that are causing it. So this one will be checked. You know, it will be checked. by the doctor. So kindly take the child to the hospital. Food that are said to help in reduction of weight when eaten by breastfeeding mom, will it have any effect of the baby weight, like cocoa oats? Yes. Well, for a breastfeeding mom, we don't encourage weight loss. We don't tell breastfeeding mom to start with weight loss program. What we advise is take balanced diet, take a lot of fluid, take fruit and vegetable, and you can never miss the road by doing this. Eat balanced diet, put fruit and vegetable there, take a lot of water. Your as far as your health is concerned, your baby is also a priority so that your breast milk can continue to go on. So the weight reduction at this stage may not be helpful to the baby or to the mom. So but just do the main thing. You can do exercise. Yeah, exercise can also help you to lose weight. Do moderate exercise, but not to do rigorous weight reduction programs. Because if you engage in rigorous weight reduction program, your breast milk may dry up, and your baby may miss the opportunity of being breastfed for the first 6 months and thereafter. Will it have effect on baby's weight? No. Good evening, doctor. Please, how long can a mother stay after delivery to start cleaning the baby cord with methylated spirit? Is it immediately or how, please? Yeah, once your baby is delivered and the baby has been cleaned by the nurses, in short, the nurses normally do the first cleaning cleaning of the baby. We use methylated spirits, but this day there is a cream that we use now, uh, Chlorogel that we use now to clean the umbilical cord. But where that one is not present, methylated spirit is used. In short, the nurse do the first cleaning. Thereafter, the mother will start. It is expected that you do it every 3 hours after birth, and also that you do it anytime you are changing the baby's diaper. You use the opportunity to clean the cord. As you are changing your baby's diaper, you just use that opportunity to clean the baby's cord, and make sure that the cord is outside the diaper, because you don't want the urine or the stool to be touching the baby cord. So where you don't have that cream plus the gel, you get methylated spirit and use. But this day is plus the gel from evidence-based medicine that is being in use. Please, sir, for the talking stomach, inu kikun, my baby has it and cries too. What can I do, sir? Yes, the fact that the stomach is making noise is not of any medical, it's not a medical issue. Normally when a baby take food, either breast milk or any other food, the baby has to go through digestion process. There's a process of peristalsis. The stomach has to mix the food together, and this involves a lot of contraction. As a result, you hear the enzyme, the acid that is in the tummy mixing with the food. The sound we are hearing is because the stomach, the intestine, the movement in the intestine is trying to mix the contents of the stomach, like the acid that is there and the food that the baby has taken in. And I don't know how old your baby is. Some baby may also have colic at this stage. Colic is as a result of the contraction that I mentioned earlier. The baby's tummy continue to contract. In some baby, especially children that are less than 3 months, it could be trouble for the parents. So such mothers, we encourage them, to keep, breastfeeding their child. When such happen, they can also back the child or just rock the child or sing for the child. We don't encourage them using any drug that people buy over the counter to stop colic. Evening, doc, please, when will a baby sit on his own properly? Yes, when we expect a baby to sit properly on his own by 6 months. Some babies start earlier at 4 months. There are some early starter at 4 months, but by 6 months, we expect a baby to be able to sit on his own properly. We say sitting without support. At the early stage, like 4 months, they may still need to support the baby, support the baby with pillow to be able to sit. But the time the baby will be able to sit on his own properly is at 6 months. That's the time we expect the baby to be able to do that. If a child is not being able to do that, I think the next month you should go to the hospital. That's by 7 months, and let the doctor know that my baby is not yet sitting properly. That means your baby is not yet sitting without support. Thank you for the response, doctor. A cord that stays with the baby up to 3 weeks and don't fall but dry, is it an issue to be worried? Should the baby be taken to hospital for evaluation? Yes, there are some cord that normally refuses to fall off. You need to let the doctor see. Even in the past, I've had course, to cut some cord, like some cord that stay more than 1 month, despite the cleaning and the rest. I've had course to cut it with scissors in the hospital and also help the baby in dressing. So 3 weeks, just try and continue to do it using the cream that I mentioned earlier, the Crozigel, and using the methylated spirit if that one is not available. And if the thing has not fallen by 1 month, take the child to the hospital. The doctor may need to cut it and dress the wound that may result from it. Yes, the baby should be taken to the hospital. Thank you. So we expect you to send in your questions. My moderator, Dr. Vera James, is off. I think she's having challenge with internet connection. She may be joining us soon if she's able to resolve the internet issue. Well, going back to the question that someone first mentioned, that's about family planning. Well, we encourage mothers to engage in family planning so that they be able to take care of their children well, and so that they be able to plan for the growth as their child is growing. Is one of the child survival strategies. In short, it was found out from studies that have been done in the past that mothers that space their children, that such children do well. Mothers that refuse to space their children, they normally have issues like malnutrition. Their children normally have things like infection, the anemia that we mentioned. They normally have issue even raising these children up. So that's why we advise that our women should engage in family planning. Space your children, space them before you have another one. Thank you so much, doctor. Baby that didn't walk or stand by himself at a year, am I to worry? If a child is not standing by a year, it may be a delay milestone. Some children may not walk by a year. We still give them the gap of 1 or 2 months to see, up to 3 months in some cases. But if a child cannot stand by 1 year, you need to take the child to the hospital. That is what we call a delay milestone. Something may be wrong. You need to take the child to the hospital. In some cases, such children are taken for developmental assessment by a pediatric neurologist, which our founder, Dr. Gbemi, is one, or what we call a developmental pediatrician now. So that child may need to be taken for developmental assessment if by 1 year the child is unable to stand on his own. Thanks, doctor, for the response. Please, my baby weighs 3.3 kg, and now she is 15 weeks, weighing 5.6 kg. Is the weight okay? If your baby's weight is 3.3 at birth and is 15 weeks now, yes, 15 weeks is 4 months. And the baby is 5.6. At 5 months, 5 to 6 months, we expect your child to be ×2, which is 6.6. Your child will soon get there. Or if I want to use the number of months to calculate the expected weight of this child, that will be, your child will get there at 5 to 6 months, is expected to be ×2, which is 6.6. The child is already 5.6 at 4 months. So your child is doing well. from that explanation. The weight is okay. Just keep doing what you are doing. Do exclusive breastfeeding. Doctor, my son of 9 years has one of his incisors refused to fall off, and the new one is fully grown at the back. What should I do? Yeah, in some cases, you may need to see a dentist. They may need to pull the old one away so as to avoid what we call what we call maldentition. That means because the one that is not supposed to be there, may displace the location of the one that is expected to be there. But at 9 years, I guess you should take the child to a dental surgeon, a dentist, who is likely to pull that one that is not expected to be there out. I think that is expected at 9 years old. My brother baby's weight 4 kg at birth, 6.2 at 14 weeks. Is the weight okay? 14 weeks is 3 months. 14 weeks is 3 months. At 14 weeks, we expect the baby's weight from the formula that we normally use, which is n plus 9 over 2. N is the age in months. So this baby of 14 weeks is 3 months. 3 months plus 9, 12 over 2, 6. The child is expected to be 6. The least expected weight is 6 kg. Your brother's baby is 6.2. That is good. It's good. The child is doing well. Continue exclusive breastfeeding. God bless you, doctor. Is it advised to circumcise a baby boy after 8 days of life when the cord has fallen? Also, which method of circumcision do you advise? Yes, normally we try to wait till the 8 days of life before doing circumcision, because it is believed that by that 8 days, some of the clotting factors in the baby, get matured, by the time it is 8 days. If it is done at early age, the risk of bleeding may be much for the child because of some bleeding disorder that the child normally have in the early days. But as the child reach 8 days, some of those blood profile, they get better, they get mature. Whether it is necessary to wait for the cord to fall, well, the reason why people wait for the cord to fall before doing circumcision is basically they don't want the child to be carrying two sources of infection. After a child has been circumcised, there is a wound that is left behind. It may be a source of infection. The cord in the child too that is yet to fall off may also be sign of infection. So in the hospital, some hospital make sure that the cord has fallen first before they circumcise such baby, while some do go ahead with the circumcision, because the method that is better now is the placebo type, because it reduces the fact that you have to continue to dress the wound every time. It reduces bleeding from the child, compared to the traditional method where you have to be pouring Vaseline, pouring olive oil, dressing the wound, and also bleeding. But the placebo type does not involve any bleeding. You can read our lecture on circumcision on the Ask the Pediatrician group. You will see that there. When can a 13-month eat by itself with spoon? Yes, your 13 months, you need to be sure your 13 months, you can experiment. It depends. Some children may start at a later time. But if your own 13 months is able to grab the spoon well, you can start the child with that. But know that most of the food may be wasted, because there is no how a 13-month we hold the spoon very well without messing up the place. So it's still an experimental stage for the child. I believe that at 13 months, the child needs to be fed. The child still needs to be fed maybe till like when the child is getting to 15 to 18 months. But there is no harm in experimenting. But an adult must always be with the child at 13 months, because at that point, the child may want to put the food in the wrong place. So an adult has to be there to guide the feeding. When can a toddler eat by themselves? Yes, most toddler by 2 2 years and above, they'll be able to eat by themselves. But like I also said earlier, somebody needs to be around when a child is eating. You cannot leave a child unattended to eat on his or her own. Such children should not be left unattended. A toddler should be attended to when eating, should be guided, and also depending on the type of food, the toddler should be supported when eating. Thank you, Gloria. So going back to family planning as one of the child survival strategy. So we encourage our mothers to do family planning, even if you see these days that the world population is increasing on daily basis, resources are getting scarce. The resources are limited. Funds are limited for people, to give their children, the best. Even some children that may need to even take like some special vaccine. Some parents may not be able to afford it because they have many children to also take care of. So we encourage mothers to do family planning so that the children will do well, because like I said, studies have been done that children that are well spaced do well at the early stage of life. The under 5 mortality is reduced in such cases. But where a woman has like 3, 4 children under 5, it's normally challenging. Some may still be breastfeeding, some are trying to get the milestone right, and some are about starting school. So it may be challenging doing all these things together. So we started by 7:30. In about 5 minutes, we'll be ending the ATP, the Ask the Pediatrician Live this evening. But we want to thank every one of you for joining us. We encourage you to also join us next week. It has been an exciting time. I want to thank all the contributors, all the people that ask one questions or the other. I want to thank every one of you, for being parts of the ATP Live. So you can send your further questions to our group page, the Ask the Pediatricians. And if it's adult questions, send to the Ask the Family Physician group. We'll be there to attend to your questions. We'll be there to answer your questions. So my partner, Dr. Vera James, is not back, courtesy of the internet service. I guess very soon, maybe next week, she'll be with us. So I would like to end here. Thank you all. Thank you for joining us. It's really a nice time being with you.